Hi, and welcome to this course about lower back pain, and what we'll do in today's class is just talk about some of the common themes to why we might be experiencing lower back pain, and I'll just give you a little bit of context around why we will be doing some of the exercises that we will do in the next class. I also talk about it a little bit in the next class as well, and I'll also provide a little PDF with the different sequences and poses and exercises that you can do. So one of the most common reasons why we might experience lower back pain is due to tightness or shortening of certain muscles that can impact on our posture. So for example, we've got the pectoral minor, which is in our upper body, so nowhere near our lower back. But what this muscle does when it gets tight, we tend to round forward, and that creates that rounding through the back, so we no longer have a nice straight back. So why posture is important is because when we've got good posture, all our vertebrae are stacked on top of each other, and this means there's less pressure on the spine, on the discs that are within the spine as well, so we are nice and supported in this position. So pressure on the spine will depend on the position of the body. The least amount of pressure that we have on the spine is when we're in a lying down position. And that's why often you may have heard people say you're slightly taller in the morning when you first wake up, because you've had that time to lie down and everything can just relax and kind of stretch out a little bit. At the end of the day, we've had that compression on the spine that's gently kind of squished it down a little bit. So if you are experiencing a lot of back pain, you might notice that supine positions, so those that are lying down, are better for you, so you can focus your practice around those. And a lot of the poses that I do give you are actually supine poses as well. So they're the least pressure on the body. Then next we've got a standing position, so standing with a nice straight back in positions like Tadasana, which is our mountain pose, our standing position. It's coming up like so. So this is where the back is nice and straight. So when I say the back is nice and straight, we still want to have those natural curves in the spine, so in the lumbar spine, in the neck, as these help with creating some almost like buoyancy in the body, so it helps with the compression, it can help us bounce, it can help with the pressure in the spine as well. So we've got our lying down position and we've got our standing position, and we'll move on to other poses, so such as forward folds. Now this is where we start to increase the pressure that's on the spine. So if we are taking a forward fold and we're hinging at the hips, then this can almost double the amount of pressure that's on the spine, because we're beginning to move gravity, so we've got gravity on the spine. However, if we round through the spine, so if I start to round forward like so, then this will create even more pressure on the spine. So to give you an idea, just for comparison, when we lie on the floor, and this would depend on body types, but when we lie on the floor we have about 60 pounds pressure on the spine. When we stand up, that increases to about 100. When we hinge forward at the hips, this can increase to about 200, and then when we're rounding, that could be 400. So you can notice it's a really big increase in the amount of pressure that we're putting on the spine. And I'm not saying that I'm not saying that it's bad to have pressure on the spine. It's just we don't want to have it continuously on the spine and in the same direction, because we do tend to fold forward more than kind of back bends. So that's just something to bear in mind, especially if you are experiencing a lot of pain. You might want to consider doing a few more positions or poses where you're lying on the ground and standing up nice and straight. Something else to bear in mind is when you do your forward folds, you want to make sure that you're hinging forward at the hips and it's not coming from the back or the spine. So I'll show you a little demonstration for a standing forward fold. I'm going to use bricks just to help me, but you can use anything. You can use a chair if you like. So starting in our Tadasana, and I'm just going to start to fold forward, so hinging at the hips. I have quite tight hamstrings, so I'm going to start to bend my knees. So I'm trying to keep my back nice and straight, keeping the natural curves in the spine. And I'm going to make my way down. So I haven't got any rounding through the spine. I'm nice and neutral here. So protecting the lower back, pulling the navel in, pushing through the feet. And push up through the tailbone to start stretching out those hamstrings. And then I might want to continue to forward fold. And I'm positioning my torso on my legs for support, keeping a nice bend in the legs. So this is because I do have quite tight hamstrings. Some people might notice they've got quite tight hips, so they might want to do this. So this is where you can start, and then once the muscles start to warm up and lengthen, you might notice that you can get a bit more length in the muscles, and you might start to increase or get deeper into the pose. But the most important thing is don't push yourself, and make sure you protect your back. And everyone's going to look completely different, and that's perfectly fine. Everyone's got different bodies, everyone's gone through different experiences. Often lower back pain is a response to something that has built up over a long period of time. So it might be that you have done a lot of running and you've not done a lot of stretching after those runs. So your leg muscles have started to get quite tight, which means when you do these forward folds, you find it more difficult to keep the back straight, or you feel that you're getting more of a stretch by rounding through the back, but then you're putting a lot of load on the lower back. So just bear that in mind. So that's just something to be aware of when you go through your yoga practice, or even outside of your yoga practice when you're picking up anything. You always want to make sure that you're not rounding through the back, because that's where you can end up putting a lot of pressure on the back. So I think I've talked about that for quite a bit of time now. And the last point that I just wanted to make, because we've talked a lot about the mechanical issues, so some of the muscles in the body, I also want to talk a little bit about the communication within the body as well. So often, or for some people, the reason we experience pain in certain areas, such as the lower back, is because the pain signals between that area. So we're talking about the neurons that go to those areas and the brain. It's not quite communicating effectively. Now there's a lot of science behind this, and I won't go into too much detail. It's just making you aware that perhaps there is something to do with the communication in these areas that's resulting in pain. And this can be related to the parasympathetic nervous system and the sympathetic nervous system. So the parasympathetic nervous system is the calming nervous system, the rest and digest. That's the system that switches on when our body is fine and there's no pain. The sympathetic nervous system is the fight and flight response. It's the one that signals if there's an area, if we're in danger, or if there's an area of pain that we need to respond to. So sometimes if we're experiencing pain in a certain area, it could be resulting from previous trauma to that area, or it could be just a disconnect to that area. So it might be that you're actually experiencing pain in a different area, for example. So that's a really just brief overview of that topic. However, what can really help with improving those communications within the body and just becoming more body aware are things like yoga nidras, body scans, meditation, and breath work as well. So if you want to start to trigger or engage that parasympathetic nervous system, then focusing on the exhale, on the breath, extending the exhale can really help to calm the body. So in the practice that I will give you, we will go through a breathing exercise and a bit of a body awareness exercise as well. However, I suggest if you wanted to give it a go, then also try body scans as well, can be really good. And there is no wrong or right way to do it. So even if you fall asleep during it, or you feel like it doesn't work for you and you're not getting any benefits, trust me, you are getting some benefits of the practice. Even just that downtime is something really precious that we don't get a lot of. However, just try it a few times and maybe note down what you're experiencing, and then that way you can always look back and see whether you have noticed a difference. Sometimes these differences or these changes are very subtle and we don't notice them, especially if we're practicing something over and over again. So if you do try that, and the same for the yoga sequence as well that I'll give you, definitely recommend repeating it and just making a note of anything you've noticed. So it could just be as simple as didn't enjoy the practice, couldn't stay still felt pain, felt like it was a waste of time. Note it down. In 3 weeks' time, you might look back on that and realise that, oh, that's not how I feel about it now, but that's how I felt about it at the time, and you can notice how far you've come. So I've spoken a little bit about the signalling issues in the body and the communication issues in the body, and for some people this can create that lower pain. I've spoken a little bit about the mechanical issues as well, and going back to the mechanical issues, I'll just talk a little bit about the support around the spine and some of the muscles that we will be looking at as well. So I mentioned that lower back pain can sometimes result from inactive muscles, and in other cases it can result for tight or shortening of muscles around the lower spine. So some of the important muscles we'll look at will be the QL muscle, which is a muscle that connects to the spine, and it's the muscle that kind of helps to move side to side. So we'll look at lengthening that muscle, because that muscle can get quite tight and it provides a lot of support for the lower spine. We'll also look at the psoas muscle, and this muscle gets quite tight. It's a muscle that connects the legs to the spine and it goes through the hips. It's one of our hip flexors. So we'll look at how to lengthen that muscle and also strengthen that muscle at the same time. So this will really help with our posture, so making sure we can stand up nice and straight, keeping that nice curve in the lumbar spine, so we're not maybe pushing the hips out a little bit and like really just letting the weight go into the lower back, which can sometimes happen when we've got quite tight hips. We'll also look at lengthening the hamstrings. So often when the hamstrings get tight, they might start to pull the pelvis down, because when muscles get tight they shorten, so they need the pull from somewhere, so that's why we can experience pain in other parts of the body. We'll also look at the glute muscles, so we'll look at the gluteus medius, which is the muscle on the side of the hips. These can help with posture again, so if these muscles are weak we may end up just pushing over to one side of the hip. This can kind of bring our pelvis out of alignment, and that can also affect pulling on the lower back as well. That can eventually create lower back pain. So I'm hoping that you're seeing a bit of a trend with these muscles and issues that I'm mentioning. A lot of the time it's not pain directly on the lower back, it's in a different area of the body, and that's what we need to work on. And once we correct that issue, which can take some time, it's not something that will happen overnight, something we need to work on for a few months. So once we correct that issue, then the lower back pain should ease, and it should get easier to manage. So this course we will be looking at some of the main areas of tightness or inactivity, and we'll be focusing on those areas. It might be that you're tight in one muscle and just one muscle, and that's enough to focus on. So it's great to run through the sequence. you can probably do it in about 15 minutes if you like. You can do the whole sequence and just record what you notice, and you may eventually pick up where the problem is resulting from. One thing that I definitely want to urge you to do is also speak to a health practitioner about the issue, especially if it's beginning to cause you any chronic pain. This is not to replace any medical advice, any health advice, anything like that. This is just to support whatever you've been given or whatever advice you've been given. This is something to help you. It's a tool to use, but it definitely doesn't replace that. So I just want to urge you to make sure you do go and speak to a health practitioner about this, because this is quite a general course. I'm trying to cover as many of the common themes that cause lower back pain. However, everyone is different, and it might be that there's something unique to you that we haven't covered today, and it's not going to help as much. Though I mean, these poses in this sequence will provide a lot of help. You might still end up with a lower back pain at the end of it. So definitely speak to someone about that, and use this with whatever other tools you've been given. So I feel like I've spoken quite a bit. I hope you find some of this information very useful, and I hope you enjoy the practice. It does go for about 40 minutes. However, I do talk a lot about the different poses and give you a few different options as well. Take from it what you need, and like I said, you can make it into about a 10 to 15 minute sequence if you like. You can obviously make it longer by doing more repetitions as well, and give it a go for a few months. Let me know how you get on. I'd love to hear how you find it, and I thank you for taking this course with me.